The novel coronavirus is a challenge that we're all going to have to meet very soon. This is March 8th, 2020, and I'm in Vancouver, Washington. We're going to talk about COVID-19. This is an image from the National Institute of Allergy and Infectious Disease, electron microscope image, and you can see the corona around each virus particle. I'm Dr. Dave Carsten. I'm an assistant professor at OHSU, Oregon Health Sciences University. I'm also a commissioner with the Dental Commission at the State Department of Health for Washington. I'm a dentist anesthesiologist. I've got a background in medical bacteriology and biochemistry. I am the chair of infection control for the Dental Quality Assurance Commission, and I'm scheduled to speak at the annual meeting of the Organization for Safety, Asepsis, and Prevention with an official from the CDC of the United States. But we'll see, with the COVID coming, some of these meetings may be canceled. I would like to give a special thank you to Laura Jordhen, MD. Laura is head of family medicine at a large hospital in Shanghai. And I'd also like to give a special thank you to Keith Collins, DMD. So let's look at the epidemiology. COVID-19 has what we call an R0 average of 2 to 3. That means how many people are going to get the virus for each person that has it. So if one person has it, they're going to expose 2 or 3 other people. Spanish flu of 1918, for comparison, had an R0 estimated about the same, 2 to 3. The fatality rate of COVID-19, the statistics from China suggest that it has a 2.5% fatality, but they don't have quite the extensive testing that has been done in Korea. And the fatality mortality rating in Korea has been about 0.6%. So because of their very extensive testing, we're thinking that that probably is the more accurate number. Spanish flu, on the other hand, the reporting was a bit sketchy, so it's anywhere from 2 to 10% fatality. So you can see it's a bit different. Treatment and vaccination are likely to be difficult as coronas are complicated and a little bit unpredictable. We are into development of vaccines right now. A friend of mine said she had volunteered to be a subject. We'll see. Usually the vaccines take about a year to develop. I'm thinking that people are going to try to see if they can do it a little quicker. So without intervention, Spanish flu of 1918 killed around 50 million people worldwide. Approximately 1/3 of the world's population got sick and infected a large proportion of the world's population. What did they recommend for treatment? There were all kinds of things, but the most popular were quinine, phenolphthalein, and dry champagne. They didn't recognize the cause until 1940 with the invention of the electron microscope. So let me give you an idea of how the fatality breaks down. So no one under the age of 9 has died. And in fact, only one person, now this is as of 27th of February, when this was published in the Journal of the American Medical Association. So no one under the age of 20 other than one person has died. But if you start looking at the statistics as people age, when you look at the decade between 60 and 69, 3.6% of those people died, 70 to 79, 8%, and over 80, 14.8%. That's very distressing. So let me give a few examples of ineffective infection control. Because what is infection control? We're talking about transmission. Public toilets usually have seat covers available as barriers. Do they work? No. Even 10 layers can still lead to transmission, but the seats, fortunately, are regularly disinfected to reduce transmission. A bigger danger is the aerosols from the flush. They contaminate the surfaces. There are bacteria and viruses deposited on handles, walls, toilet paper. Toilet paper is not sterilized or even disinfected. Think about that. The power hand dryer creates aerosols that spread pathogens, mostly because people don't wash their hands well. That's concerning because those aerosols get into the air and they may take as many as 30 minutes for the majority of the aerosol to settle. Now, if it was measles, it would probably take several hours. Influenza does remain infective for about 30 minutes, and we believe that this coronavirus is also staying in the air for about half an hour. So infection control is about stopping transmission of the virus from one person to another. So how can we do that? I tell you what, I've been involved in trying to change the rules in infection control for the last 3.5 years. And it's been very frustrating because people are reluctant to change what they do right now. So the virus is novel. No humans have immunity until some people recover. Now, there are some tens of thousands of people that have recovered in China at this point. There are no treatments available. No drugs or vaccines are proven to be effective. There is some experimentation with antiretrovirals or in other antiviral drugs, but it's not proven. And treatments that help are at least many months away. Hospitalization is needed when breathing becomes difficult, when this turns into pneumonia. So the one proven method to stop a virus like this is isolation until it runs its course. This is going to be difficult to enforce in the United States if we decide to take that approach. They've taken that approach in China. They've had their dental offices in many places where the public has gathered, even like grocery stores. They've mostly shut that down or very much limited public contact with other people. And only now are they starting to open up some of those venues again. All families should know that although the virus is dangerous, it is less dangerous for children. No child under the age of 9 has died. At high risk are people with health conditions such as heart disease and diabetes. The death rate for people over 80, as I said, is about 15%. The death rate for people between 70 and 80 is about 8%. So third world conditions do seem to lead to a much higher death rate of perhaps 5%. The death rate in Korea is about 0.6%. And we think that's probably because they've done much more extensive testing on the population and they have a better number. So for comparison, influenza death rate is about 0.1 to 0.2%. So the assumption is a likely death rate in the US will be less than 1%. Now currently in Seattle, it looks like it's more like 5%. And we think that's simply because we haven't been testing the public very much. Very few tests have been run in the United States. About 1% of people show no symptoms at all, but can spread the virus. That's actually one of the difficulties. When people don't show symptoms, but they can spread it, they can go anywhere, no one will know, and other people will get sick. And especially we're concerned about elderly. 80% have mild symptoms of a cold. The virus can spread prior to the person showing symptoms, and this makes it very easy to spread. Typical is that the infected person exposes 2 to 3 other people who get sick. 99% will have at least a mild fever, and that's a key detection point. We can check to see if people are having a mild fever. Now in China, they're very clear about that it's 37.3 centigrade, about 100 degrees Fahrenheit. So if somebody shows a fever, they're going to send them home. And in fact, what they do is a triage. They ask them over the phone, and then they check them when they arrive. So transmission is via oral fecal, aerosols, contact with objects, and contact with infected people. So recovery seems to take about 3 weeks. The common sense recommendations are that people have healthy habits. Tell children to stop eating junk food, eat their veggies, get enough sleep. They're going to be more resistant and recover better and more quickly. Wash hands frequently and thoroughly. Happy birthday twice with good technique. Make sure you get your thumbs in all your fingers. That applies to both soap and water and to alcohol. Washing after touching objects that may have been touched by others is a good idea. Alcohol for hands is good, but not as good as soap and water. So I would recommend, if you have soap and water available, use that. After bathrooming, washing is especially important as the virus is also oral fecal. Don't touch your face. Don't touch your face. That's essential. Don't touch your face, because if you get your hands contaminated, although skin is a great barrier, once you take your hands and put them onto your face, you've transmitted the virus to yourself. Minimize contact with other people. Stay at about a 2-meter distance or more. That way, if somebody does cough a little bit, it's unlikely that enough viral particles will come to you. Avoid gatherings of people, because you're just increasing your chances of having transmission. I know that a lot of people are concerned about masks, and in fact, there's been a run on masks in the United States. Well, we don't have enough in many hospitals. They don't really work to protect the wearer unless you're using a very high-end mask called an N95. The N95s are not available to most people, and they won't even work unless you've had training in the use of an N95 mask. Besides that, those very expensive masks are only good for about a day of wear and fail once they're wet or soiled. The largest concern with children is exposing parents or grandparents. The most likely outcome is that grandpa could get very sick and perhaps die. The risk to the child is not zero, however, but it's very, very low. For professional staff, phone triage. Recommend not seeing people who in the last 14 days have had a temperature above 37.3 centigrade, about 100 degrees Fahrenheit, have any respiratory symptoms, have contact with people that have been diagnosed with COVID-19. Screen them upon arrival. Positive screens are sent home. Take the temperatures of all people, review their symptoms, social history, travel history, and health status of household members before allowing them access. Aerosols from a cough or a sneeze can be a problem for about a half hour. Please take that into consideration. Consider moving to telemedicine if you're a medical or a dental office to avoid the spread. For possible contact with infected individuals, I recommend the N95 respirator type mask and PPEs, which do require training for use. So if you are a medical or dental provider, you've got to consider that if you don't have that N95, you may not be really in a good position to treat a patient that has an infection or even a risk of infection. Removal of PPEs, personal protective devices, is the highest risk of self-contamination, particularly with the mask itself. As that mask is removed, you need to remove it at the ear loops. Then you're going to take the edges and you're going to fold it in and then fold it over, wrap it, and throw it in medical waste. And then you've got to wash or clean your hands. And I'm only going to demonstrate because it really does take saying happy birthday twice. There is a summary article from the Journal of the American Medical Association. I'd recommend you read it. I think it's very helpful. So just for the comparison, the influenza statistics from the CDC, you can see that influenza is around that 0.1 to 0.2 fatality rate. This is quite a bit higher. We're estimating from the Korean data about 0.6. Now, as you can see, what they've done in China is they've stopped everything. They put a halt to people movement. That has stopped transmission. Their incidence of infection has dropped precipitously, and now they're thinking about how they can perhaps open their clinics again. I wanted you to see how I've been tracking this. This is through the Johns Hopkins website on infectious disease. And I went back to the 3rd of March. And as we step through to the 4th and the 6th and the 8th, you can see the number of infections growing in North America. That is what's happening. Now, at the bottom of the slide, I wanted to mention that this approach worked in Garrison, Colorado in 1918, where they shut off the town from all outside contact. They stopped having public meetings. They tried to keep people to their homes, and it worked. Nobody in that town got sick. Stop transmission. So let's give a quick recommendation. Don't shake hands, hug, or kiss when greeting people, unless they're immediate family members. Wash and scrub your hands and nails well with soap and water. Remove your shoes when you come indoors. Don't take your shoes in your house. Unfortunately, you will probably have oral fecal bacteria on the shoes. And in fact, what I would recommend as you come in, remove your shoes first, use your alcohol, take off your coat, use your alcohol, take off your hat, use your alcohol, and then remove your mask if you're wearing one and dispose of it properly, and then clean your hands once again. And that way you can safely enter your home. Be mindful of touching doorknobs in public spaces. The doorknobs may well be contaminated. Stay home if you're sick. I know that it's tempting to go to work when you have the sniffles, but right now, well, anytime, but right now it's a particularly bad idea. Cover your nose and mouth with your elbow when you sneeze. Hand sanitizer and antibacterial wipes to clean your hands and sanitize surfaces. They work in a pinch. It's a fine idea to carry it around in your pocket or have it at home, but really soap and water works better. Wear gloves. I want you to consider, if you're wearing, say, leather gloves, how are you going to sterilize them? It's going to be difficult. So are you going to carry around nitrile gloves? Well, perhaps. Wear a face mask if you're sick. In this circumstance, face masks protect the public from use. So for instance, if you're on your way to see your doctor, maybe wearing a face mask would make sense to protect other people. But unless you wear an N95 mask, it's unlikely to protect you, because you've got to get to that level to have a seal. And don't touch your face. Don't touch your face.